Hi, welcome to Beyond Breathing, the podcast for everyone who breathes and sleeps, and where we explore the latest advancements in healthcare that are changing the way we approach education, screening, and treatment of sleep and breathing related disorders. I'm your host, Lancette, and today we're diving into the world of sleep apnea and the quest to revolutionize treatment beyond the traditional CPAP machine. Sleep apnea affects millions of people worldwide and people of all ages. Sleep apnea disrupts our sleep patterns and poses serious health risks. And for decades, the gold standard treatment has been CPAPs, or the continuous positive airway pressure machine. But with advances now in medical technology, researchers and innovators are exploring new alternatives that offer greater comfort, convenience, and effectiveness. The gold standard of a CPAP is changing, and patients are encouraged to seek out an option that is best for them based on their unique circumstances. Getting tested for sleep apnea and getting treatment for sleep apnea could save your life. The consequences of untreated obstructive sleep apnea are numerous. Untreated obstructive sleep apnea is an independent risk factor for heart disease, high blood pressure, and stroke. Patients with untreated obstructive sleep apnea have 3 to 7 times more car accidents than other drivers, and the psychological consequences are intellectual deterioration, as well as personality and behavior changes. And not to mention, not treating your sleep apnea can actually take years off of your life. The 5-year survival rate has been shown to be decreased in patients with untreated obstructive sleep apnea, particularly for those under the age of 50. So let's start by discussing the limitations of the CPAP machine. While it has been the cornerstone in sleep apnea treatment for many years, many patients find it uncomfortable and struggle with compliance. One recent study looked at the CPAP use over the last 20 years and found compliance is about 34%, which means only about 3 out of every 10 people use it as recommended. Some people cannot tolerate the noise, the fit, or the cumbersome tubing of the machine at night while they sleep. Others may use sometimes, but not all the time, or not for enough time per night. It is critical to note that many people have been very successful with CPAP machines and cannot sleep without it. However, we do know that co-therapy, CPAPs can even be more effective when combined with other treatment modalities, such as evaluation with an ENT, mouth taping, or even mouthpieces. It is important to note that when we look at healthcare now, there is no longer a one-size-fits-all approach to the medical management of sleep apnea. And the new gold standard may include whole person centered care and conversations between many medical and dental providers to identify the root cause of the obstructive sleep apnea and then determine what treatment options may be available before a CPAP is even dispensed. So let's look at some alternatives that are emerging in the treatment of sleep apnea. One promising alternative is oral appliance therapy. These custom-made devices are worn in the mouth during the night, during sleep, to help keep the airway open and prevent the airway from collapsing during sleep. They're more comfortable than CPAP machines and offer greater flexibility, especially for patients who travel frequently or just have difficulty adjusting to wearing a mask. There are a wide variety of oral appliances. This is really where we're seeing some exciting new changes. Some oral appliances are jaw repositioning devices or mandibular advancement devices. Some appliances, like this one that I'm showing on the YouTube video here, is a starter appliance. It's a rubbery, soft, flexible material that allows people to get a really good lip seal. It does reposition the jaw and move the mandible and base of the tongue forward. It also has a tab on the top here that goes behind your front teeth, drives your tongue crazy, gets your tongue up to the roof of the mouth. We know that the tongue has to be at the roof of the mouth during sleep to get really good nasal breathing and to get the tongue out of the throat. We do know that one of the primary culprits, one of the root causes of many cases of obstructive sleep apnea is actually the tongue. So moving the jaw forward, getting the tongue out of the way, strengthening and training all the muscles around the lips and face that are involved in breathing and sleeping and swallowing and speech can be game changers in helping adults and children breathe, and sleep. These soft, flexible starter devices that I'm showing here on the YouTube video are actually a really good test also to determine if somebody is a good candidate for oral appliance. Because these are inexpensive and very fast to get, people can determine if they can tolerate having something inside of their mouth or not. So these starter appliances are pretty amazing. Another oral appliance that's an option for people is the Vivos mmRNA, which is FDA cleared to treat mild, moderate, and severe sleep apnea. These are orthotropic appliances. They can help increase the size and the shape of the dental jaws and the airway by creating permanent structural changes, opening things up, making more room for the tongue, and allowing better oxygen support at night. These appliances are typically worn about a year to help encourage growth and development and expansion of the airway and the dental jaws. These are super comfortable to wear also, and for many people, they wear them for 12 to 18 months and then they don't have to wear any appliances or any masks. And for other people, this might actually just help increase the size and shape of the dental arches and make CPAPs more comfortable. And are a really great option for anybody who has adult permanent dentition. So we also know that there are airway-focused orthodontics. Candid, for instance, is an airway-focused orthodontic company. So oral appliances are very, very popular. Many appliances have gained FDA approval for the treatment of mild, moderate, and severe sleep apnea. Not to mention, people love the comfort and convenience of a mouthpiece for better breathing and sleep. Another recent development is the use of the hypoglossal nerve stimulation. This involves implanting a small device that stimulates the nerves responsible for controlling the muscles in the back of the tongue and in the throat. By keeping these muscles toned during sleep, airway obstruction can be significantly reduced, providing relief for patients with moderate to severe sleep apnea. One area of active research is the use of positional therapy devices. These wearable devices monitor a patient's sleep position and provide gentle prompts to encourage people to shift their position while they're sleeping if that certain sleep position may be exacerbating their sleep apnea. While we know positional devices are still in early stages of development, these devices have the potential to offer a non-invasive and user-friendly option for patients with positional sleep apnea. It is inspiring to see how technology is driving innovation in sleep medicine and improving the lives of those affected by sleep apnea. This podcast is for educational purposes only and is not professional medical advice. My personal advice would be to you: explore all available treatment options and work closely with a variety of sleep specialists, including a dentist, to find the approach that's best suited for your individual needs. With the advancements we've discussed today, there's more hope than ever for effective and comfortable treatment of sleep apnea that may or may not include a CPAP. Thanks for tuning in. Remember to subscribe, rate, and download Beyond Breathing for more discussions on the latest developments in healthcare. Until next time, breathe well, sleep well, and live well. And thank you to Sierra Sleep, Airway, and Wellness Center for sponsoring this episode. You can visit www.sierrasleepwell.com to learn more about the oral appliance therapy that I was talking about today. Until next time, bye-bye.